Good morning. It's Wednesday, May 20th of 2020, and I'm going to take you along with me today for a day in the life. I'm a doctor of optometry, and today is my third day back seeing routine patients after being closed for 2 months for COVID-19. So I own my own practice. It's in Salisbury, North Carolina. I make videos for my practice here on this channel. So if you like videos all about eyes and eye health and wellness, please make sure to like and subscribe down below. Leave me a comment and let me know where you're from, why you're here, and I look forward to chatting with you. So 2 months ago, almost 2 months ago today, in March 17th, the CDC came out and said, due to COVID-19 and what's going on in the world, it's time to stop seeing routine care for a little bit. So you may be aware of that hospitals stopped doing routine surgeries and doctor's offices stopped seeing routine patients. And as a doctor of optometry, I'm no different. So I stopped seeing my routine patients, and what I did for the last 2 months was adopt telemedicine, as well as seeing any emergency and urgent patients. And what that means, so emergency patients are at risk of like losing vision or have something that has to be taken care of right now. And urgent has, an urgency to it. It needs to be taken care of in the short term. Patients more like my glaucoma patients, folks who are having they have controlled pressure, they have controlled diseases and could go a week or two or a month or two. We didn't see those patients during that time. And so last week was dedicated to catching up with all of my medical patients that we had delayed. And then this week we've started routine exams, and it has been so nice to get back to the clinic. I've definitely had mixed emotions about the whole thing. Very, very hard to just make sure that you're keeping your team safe and yourself safe and your patients safe, but we have a lot of protocols in place. And so as I get to the office today in a little bit, I will definitely show you some of those protocols and show you, bring you along with me as I go about my day. Now it's gonna be a little bit slow because we're actually just seeing one patient every hour, and that's so that we can clean and sanitize and absolutely keep everyone safe. Let's go check it out. All right, so when I got here to the office, the first thing I did was take my temperature and my pulse ox and get a mask, and then I saw a patient. It was just a routine, super healthy young person, so not much to talk about there. And now I'm settled in at my desk. I've got my coffee with me, and today is Wednesday, so we've got a new YouTube video coming out today. And I am just getting access to it now. I do get help with my YouTube videos. I have a wonderful agency now called Dream & See. They're local here in Salisbury. I used to edit all of my own videos, but if you've noticed, they look better now. It's because I've got some great help. We've got access now to today's video, so just reviewing. We had a couple of changes to make, but that's what I'm doing right now.
My gold lens.
Here we go.
Those on an actual person and show you, here's my green lens. Can you appreciate that shimmer?
No, wrong.
So
new patient, he only wears readers. He doesn't have any vision problems really. He says he only wears them. It gives him headaches sometimes. His pressure was okay.
Okay.
Vision wise, he has a left eye's lazy eye. He said, and he said the last time he went to the doctors, they tried fixing that eye, putting like a higher prescription in that eye to make it better, but.
Okay, so I've got a patient ready. Taking a look at the video, it looks pretty good. There's a couple little things we have to fix. When you have an outside editor, it's, they just don't really necessarily know all the B-roll, what it goes with. So we have a couple little things to fix, but we're gonna get those changes made, and then the video will be ready to go live later today. So Bobby just handed a patient off to me. I've got one ready, and I'm gonna go see them. And Bobby is actually starting optometry school in the fall, as long as everything, kicks off like it should. She's gonna be going up to Salis in Pennsylvania. So she's been with me for several months, and she works up my patients and hands them off to me. So it sounds like this is a pretty routine day so far. I had a young one first thing, and then this next patient does have a lazy eye, so we'll see what that's about. Self-proclaimed, so you don't always know exactly what that means going in. So we'll see what the deal is, and I'll report back. All right, so I just finished up with a patient. That was my second one today, and he is doing really, really well. So 47-year-old guy. Started to talk to him a little bit about, you know, his health, and he said it's all good, it's all good. And so many people say that, so I am in the habit of always saying, okay, when's the last time that you saw your primary care doctor? And so he had seen one within the last couple of months. But it's really funny because one thing I've noticed is that a lot of my patients, they come to see me because they can't see. And if you can't see, that's something that's like, you know, urgent for most people. They'll come into the eye doctor. But there's so many of my patients that haven't seen a primary care in years. And so I feel like one of my roles is to always check in with my patients and make sure that they're being seen and monitored, that they've had their blood pressure taken. That's one of the greatest things that we do here. I cannot tell you how many people we've caught high blood pressure. Here at my office, you know, when COVID happened and they started talking about, you know, utilizing pulse oximetry, I actually already have pulse oximetry in my practice. That's part of our workup, and that's not normal for a doctor of optometry. I don't know any other doctors of optometry that are checking that on every patient, but we actually check height and weight, blood pressure. We have the capacity to check blood sugar. We don't do it all that often because it's doesn't tell us really all that much. That's a whole nother video, but we always check pulse oximetry too, because that tells me a little bit about their perfusion, and perfusion matters for the eye just like it does for the feet or hands, and it gives me good information. So anyway, that's kind of my own little soapbox, but this particular guy, he had been to his primary care, but he asked me, he's like, why does that matter at the eye doctor? And so I always love telling people why it matters. It's so, so important. Okay, so I am gonna work on administrative type of stuff. We are kind of getting back in the swing of things, and so we have a lot of communication aspects to the practice that I need to work on. It's really important, obviously, to communicate with my patients about all the changes. We're testing every single patient as they come in, their temperature, their pulse oximetry, and we're asking them a series of questions. And one thing, as a doctor and as the owner of the business, it's really important that we have all of these protocols in place, and so I've got to work on a little bit of that and just the communication aspect side of my practice. So I'm going to do that for a little bit.
But like
talking marketing.
That conversation.
I agree. No, this is the most fun ever. I love figuring this out because I feel like once we get it going, we can't be stopped. It's going to be just
I'm
like...
at that point where I'm right before I crack the code and I'm like, oh, this is really difficult. But then once you figure it out, it's like, oh, this is great. I feel amazing.
Yeah, I think we're going to be pumped.
Yeah.
All right.
Do you say?
I'm trying a telehealth appointment right now. Let me remind myself what I had going on. Telehealth is awesome. I've been utilizing it quite a bit. In the 2 months that we were completely closed for routine evaluations, I was using telehealth, even for like the first appointment with somebody. Now that we're back seeing routine patients, I'm still trying to use telehealth as much as humanly possible. Ocular patient I saw yesterday, she was super concerned about her eye. I think she had rubbed it sometime in the night. It's kind of what we decided must have happened, but she had a fairly large central abrasion / recurrent corneal erosion. It was already re-epithelializing when I saw it yesterday, so it was looking good and it was starting to do some healing. But she's a contact lens wearer, and so instead of doing a bandage contact lens, which a lot of times I would do, let's get an antibiotic on board. And let me check in with you tomorrow via telehealth. So this is not a billable exam. This is just me checking in with her to see how she's doing. But I love it. I love that I can do this and actually like get my eyes on her and she can see me. I feel like the patients feel a lot better. If I had just had my staff call, I feel like that's just a different experience. And so in a way, telemedicine is really, I think, enhancing the experience with doctors. So yeah, I'm gonna go ahead and get signed in here. Hi. How you feeling? Do you really?
Yeah.
Good. Good, good, good.
Good.
Okay, so do you have any questions at all for me? Okay, well then I'll just see you tomorrow. You're welcome. Have a good day.
Say bye.
Bye. Hey. She's doing really well. So I was pretty concerned. It was a pretty large central abrasion, but a day of not wearing contact lenses and using her eye drops, and she's good. And look how easy that is. I love telemedicine so much. Of telemedicine, normally if you're billing, you do an entire record. What I'm gonna do, I'm not billing for this exam, so I kind of consider it part of yesterday's exam. So I'm in her record from yesterday. I'm gonna pull it up and I'm gonna do an addendum. And I'm just gonna talk about the fact that I saw her via telemedicine. She consented to be seen that way, and how she's doing, what I looked at. And one thing I always put in my records is return to clinic sooner if RSVP. This is something I got from Bascom Palmer. I don't know if I learned it there or if lots of people use that. Comment down below if you use it too. But RSVP stands for redness, sensitivity to light, vision changes, or pain. So for a lot of conditions, I'll educate the patient about this, and it's kind of a nice, quick, easy way for them to remember what they're supposed to call back, what symptoms they should call back about. So I'm just gonna finish up this addendum and get the records squared away, because that's so important all the time, and with telemedicine. Just like that, all done. So this last patient I saw was a little boy, 4 years old, and he was referred by his daycare because they do a screening test that picked up on kind of asymmetric prescriptions and isometropia. So little guy is farsighted, very different prescriptions between the two eyes. When I saw him before, neither eye saw very well. And today, using LEA cards, which are a special card that you can use for kids to check their vision. His vision was 20/20 in the right eye, 20/32 in the left. Awesome. So just by giving him glasses, we've already improved his vision a whole lot. And the next step is to initiate a patching regimen, which I went over with his mom. And I wrote a letter for his daycare, because he goes to a really great daycare that is really great about implementing care plans like that. So they're getting the letter, and that's the plan. Young healthies, glaucoma patients, diabetic patients, you know, on to a 4-year-old. So this is a typical day. It's absolutely a typical day for me. One more thing about that little guy. So I love this. His mom and I were talking about him getting glasses, and I said to him, I was like, what do you think of your glasses? How are they? Do you like them? What's going on? And he was so shy, and he's just like, oh, they're good. And his mom said that when he put them on, he said that they were magical. She's like, I almost cried. He's never used that word before, ever. And he put his glasses on and was like, Mama, they're magical. So anyway, I had to tell you that. I just love it. So I got an email from the North Carolina board. So I'm actually a board examiner. I serve as a clinical examiner on the board. It's interesting, you know, what they're planning as far as the board this summer. It is definitely still on, and we'll be social distancing, not only with each other, the examiners, but with the candidates as well. And you know, lots of special concerns with the hotel we'll stay in, and it's just really interesting. This has affected every aspect of life, but yeah, that's something I'm kind of going over right now. This afternoon I've got a couple more patients to see. I'm not sure what's up ahead. I honestly usually don't look to see who I'm seeing later. I used to, I think as a student, I would always kind of look ahead and see, are they new, are they established? I don't know, I guess doing this over 10 years, I'm just kind of like, okay, who have I got? I can kind of go at the drop of a hat at this point. So yeah, I'm not sure what I've got coming up, but I think I've definitely got a couple more to finish out the day. I've gotten a lot done administratively. Our YouTube video drops in a few hours and we're totally set with that now. I am good as far as like, you know, paying some of the practice bills and putting checks in the bank and documenting all that stuff. So just working on all the admin stuff. There's a lot of that, but I enjoy it. I enjoy it a lot. My face from the mask. Okay, so I just saw father-son combo and both were doing really well. You know, refractively, like need for some reading glasses, but they both have ocular hypertension. So ocular hypertension just refers to having high eye pressure. And of course, eye pressure is something we test on every single patient, every single time. And it's just one of several indicators that we use, one of several tests we use to assess a person's risk of glaucoma. So it's definitely not to be used in isolation. It doesn't really mean anything necessarily on its own. Yeah.
His pressure was 31.
Was it? Okay.
I don't know if you...
Then let's get him back for a glaucoma workup. For sure.
But that's still kind of high.
Let's get him back within a month or two and dilate him and do, since he didn't today, and then get the scan in the field. Do you want me to come talk to him? Okay. What was his blood pressure?
I'm doing that right now.
Okay.
Him some time to... This is gonna be high.
Get his blood pressure, and then I'll pop in and tell him the plan.
Okay.
Update. The pressure was high. Yeah, so the dad's pressure was 31 in both eyes. He's a little apprehensive, doesn't like having it taken, so, but that kind of changes it for me, so we'll definitely do a glaucoma workup on the dad. The son's was just 22, so normal pressure runs between 10 and 20, 21, so high side of normal or just kind of low side of abnormal for him. So, and he's 16, no other risk factors, so we'll keep watching that one. But the dad, I think we're gonna have to take a look at his glaucoma risk longer term. So we'll get that going. I gotta go talk to him. Finished up with a follow-up appointment. This is a patient I saw a week ago. She is a contact lens wearer. She sometimes overwears lenses and has a history of ulcers. And about a week ago, she called and said, Dr. D, I did it again. I have an ulcer. So I said, get in here. Let me take a look at it. And luckily it was not an ulcer. It was an infiltrative keratitis. So a little bit of inflammation within her cornea and no ulceration in her case, no infection. But I covered her with an antibiotic and then added a steroid to calm down the inflammation. This particular patient, I've treated her with steroids before, and I knew that she was a steroid responder and it would potentially raise her eye pressure. And so I had her back today, but her pressure looked great. Her cornea looked great, and all is well. She's gonna taper off of the drops and get started with contacts again next week. So all done with that one. I think I've got about one more patient today, and I'll be done with patient care. In between today, I've gotten a lot done, and this is one thing that as a business owner and doctor, you are kind of always managing. So there's a lot of checking in on email. There's some bill paying and things like that too. And it's honestly just something that I go back and forth and I juggle all of it throughout every day. So I love it. I think that every minute is sort of a little bit different. I get to see patients and run a business, and I have to learn insurance and all kinds of things. But I actually enjoy it a lot. So it has been a day of high eye pressure. I just finished up with my very last patient of the day. And just like my father-son duo earlier in the day, this patient also had elevated intraocular pressure. So right now, no other risk factors. This particular patient thought that maybe her mom had a pump of some kind in one eye, which would really lead me toward a glaucoma history, glaucoma family history. But just, she's gonna find out from her mom and kind of get back to me on that. So I think it's been pretty interesting day. It was like high eye pressure day for some reason. So lots of talking about glaucoma and risk factors and breaking that down with patients. But I will just say it is incredible to be back seeing patients again. I've been doing this since 2009 and I love it. I love seeing my patients. I love talking to them. And being off for 2 months, that's the longest I've ever been away from them. So I'm just really happy to be back. I hope you enjoyed this day in clinic with me. I'm gonna wrap things up here at the office and head on home and go see my daughter. And then my husband will be home in a little bit. All right, I hope you enjoyed this day in clinic, day in the life with me. This is my first one ever. So if you want to see more videos like this, make sure to leave me a comment down below. What would be illegal?
You asked her how old she was.
Oh.
Because you're not supposed to ask that, like,
I know.
interviews and stuff.
Yeah, you can't ask anything. I still don't know how old you are.
You don't know how old, I told you.
Don't tell me. I don't want to know. It's illegal.
I'm 25 in September.
Ah!
24.
Duh.
I told you.
This is a big start.
My hair is very thick.
All
Yes,
right,
there's
we're
so
taking
much,
classes
you know?
outside so
I need
that
to get
you
it
can
thinned
see them
out.
both indoors and out.
And the funny thing is,
Before
like, I know
that,
you don't
do
tease it or
want to
anything.
mention
Oh,
that
Lord,
I'm
no.
sitting next to a
Oh, God,
really
no.
large
Can you
mirror
imagine?
right
That's
here.
just how your hair is. Look at y'all, professional on your telehealth with your fancy scrubs.
Honest to God, I love these. I really love these.
They're spiffy.
And I'm honest. I might want to do black for my site. I just am really liking the black. I feel fast. I just feel like I'm fast, slick, can move fast.
Like a freshly bathed dog.
Uh-huh.